morning, everybody. Dr. Gabriele Jasper MD, interventional pain physician. Interventional pain physician, I always like to tell you what I do. What we do is we try to find the pain and we eliminate the pain generator.
Mm.
There's multiple pain generators. A lot of them give the same kind of pain. It's my job, and I always say it to patients, makes my job interesting and hard at the same time. And you develop a technique after 25 years of doing these procedures.
Sure.
And but also I like to tell you where we are. Tell them where we are, Jeremy.
Yeah, we're in building number 7 at the Pavilion on
Okay.
74.
We're at 74 Brick Boulevard.
Sorry, Doc.
Brick, New Jersey. And we're building number 3 in the back there. Tell them what our what are you getting? You getting what do you call it? Nervous about being on the air here?
Yeah. Oh, yeah. My first time.
Yeah, it's your first time. Our website and
yeah, we if you want more information about Dr. Gabriele Jasper and all these things, wonderful things we're going to talk about, you got to go to jaspermd.com. If you want to make an appointment with Dr. Jasper, just call the number. It's 732-262-0700.
0700. You may put that on the screen.
Yeah, right there.
We're gonna talk about a lot of stuff that people have been following me. I haven't been on for a while. Summertime.
It's been a minute.
Yeah, and I like to go over a little bit of everything. This is live, right, on YouTube.
Yeah,
on Facebook.
YouTube and Facebook.
It's live, so you can do that. You can watch us live.
And everybody on Sunday morning from 7 to 8 who are listening to us then, hello. If you want to listen to us live, we record the show on the day before from
10 to 11.
10 to 11. So join in and you can ask Dr. Jasper any question you want.
So right here in Bricktown, it's good because it's right off the Route 70, which is right off the Parkway.
Yeah.
Exit 89. Exit 89, either way, coming from the north or south. Jump off, and we're probably 4 minutes from the exit. 732-262-0700. It's right on the screen.
Yep.
And one of the reasons why today's Tomato Day, which means that at the end of August, the beginning of September, we do about, 350, 400 jars of tomatoes. And we probably use about 200, 225 a year in my family. But we have other people that are interested in doing it. They buy 2 or 3 cases of tomatoes, and they come down and they learn the process. Right? So they're kind of like our migrant workers. Philip and Felix are organizing it. I used to be me when the kids were small, but now Philip has the passion of it, and we got the cousins coming out. We got Tatiana, we got Frank, we got Vince Chimenti, his wife Beth. Everybody that shows up wants to learn how to do it, and some of them come all the time, and they take their cases of tomatoes and they go home.
Yeah.
Anyway,
it's a good time, though, is what we're saying.
Yeah, they're probably upset about the fact I'm doing this. However, I'm doing it for a reason.
Right.
One of the reasons I'm doing it is because I want to talk about compression fractures.
Yeah.
And one of the reasons I want to talk about compression fractures, it's one of the things that are not treated properly in the majority of the world. Maybe I'm not sure about Europe and Asia, but I know in America it's not treated properly most of the time.
Right.
Compression fracture is what you call is a broken back. You got a broken back, and you're breaking this part of the back. It's called the vertebral body. It cracks. It can become a wedge fracture. It can become completely crushed. But what's very characteristic of this, it is severely painful. A patient comes into my office, especially somebody I know, comes into my office, I could tell when they have a compression fracture. They can't sit still. They can't find a position. They can't take deep breaths. The heart rates are up. The blood pressure's up. Pain scores are 10. They say it's a 20. It only goes up to 10. They say a 20. And you could tell by the expression on their face with the anxiety, the grimacing, There's not. I don't think there's any really pain more than that. You don't get too much more pain, especially, and it happened in acute onset.
Right.
Right, it happened all of a sudden. And the reason why I'm talking about it is because I saw the news the other day.
Yeah.
On Rudy Giuliani. Right, he had a car accident, and the first thing they're talking about is compression fractures.
Yeah.
Right, but they didn't say anything about him having surgery. How if he got it fixed? He sat there. He was talking about it. He explained about, and I could tell by looking at him he was in a lot of pain. He's a stoic guy,
Right.
but I could tell being a pain doc that he was in a lot of pain, which tells me that he did not have it fixed properly.
Right.
See, a lot of these doctors are very conservative, which is nothing wrong with being conservative.
Yeah.
But when you got a pain like that, especially I think Rudy Giuliani is in his 80s, and most of the people have pain that have this, and most of the people that have compression fractures are older. Why? Because the bones are more brittle. They could have osteopenia, osteoporosis. You get that checked by doing a bone density. And some people have it spontaneously. A lot of the older women, because of the hormone changes, they don't get properly checked. They don't get bone density. They go into osteopenia, osteoporosis, and they sneeze and they break the bone.
Oh boy,
that's one extreme. The other extreme is you get a young person that has a bad car accident.
Right.
Race car drivers, boat racers, which I've had them all, and I fixed them all. The ones that come to see me. And somebody like Rudy Giuliani, he might not even have osteoporosis, osteopenia, because of the fact that it happened during an accident, car accident. It seemed like it was a pretty bad car accident.
Right.
For you to break a spine, break the vertebral body, which is called a compression fracture, in a car accident, it has to be significant. So the point here is, I can fix that. How can I fix that? Very simply by doing a very non-invasive, they might call it minimally invasive, but it's non-invasive. It's quick, it's easy. In the right hands, if it's done right, it's not dangerous at all. I mean, no matter what you do in the spine, it's always got its complications. And this is one of the reasons why people don't treat it, because they're afraid of the complications. You can have a complication with any kind of procedure. You can have a complication giving somebody vitamin B12 shot. If they're allergic, they can go into anaphylactic shock and die.
Right.
So the point here is it worth the risk of fixing a compression fracture? I think so. And so do most of the people who do it that aren't intimidated by doing the procedure, which is called a kyphoplasty. We used to do vertebroplasties, but now we do the kyphoplasty. And what is a kyphoplasty? A kyphoplasty is very simple. We there's a bridge here, right? We come in through the back, and I'm talking, we make an incision, it's just a little puncture. It's like a needle. We come in with a needle, right? A large gauge bore needle. We come in and we go through this bridge and we put it where the cracks are. You got to know how to read the MRIs and see where the cracks are.
Yeah.
Could be cracks maybe on the superior part, inferior part, left lateral, right lateral, wherever it is. That's where you got to go with the tip. Right? And then you fill it up with an epoxy. They call it cement. Yeah, I'm going to put cement. No, it's not. One patient says cement. I said, yeah, we're gonna have a cement truck in the back of the truck, in the back of the office here, with spin in the back thing. No, it's not cement. It's an epoxy that we mix, and it becomes very warm, and then we put it in, and it fills in the cracks. Because the pain is the fact that this is broken, and when this is broken, it crunches
when you're moving about.
Yeah, it's like somebody snapping their arm, right, and it's hanging, dangling. There's nothing worse pain than that. But once they set it and they put it in the proper position, you don't feel it anymore because it's not moving. And when this sets, when the epoxy sets, the cracks don't move and the pain is instantly gone.
Yeah.
I probably well in a 90 percentile, like maybe 95 to 98%, get off the table pain free.
Yeah.
And
I saw a very old woman. Her back was they used to call it the back, your back's broken, right?
Yeah.
She was thrown in the back of a van on the way back from her husband's funeral, right? And she's bouncing around in there, and she got a compression fracture in her vertebral body, and she came to you, right? And I saw her before, and then I saw her after. and she was amazed by how the pain just was gone.
I did 2 of them the other
Yeah.
day, and the same thing. Gone. Call them the next day. Gone.
Yeah.
The only time it might not go away 100%, and I found out that you do the MRI and you fix it a week or 2 later, there's a chance that they could, especially someone with pathology like osteoporosis, could crack another one. By the time you fix that one, the fresh one, there might be one in between.
Mm.
And that's very suspicious when I fix it and they don't have any pain relief. I send it for a new MRI, and most of the time it's another fracture.
Yeah.
But anyway, one of the reasons why I wanted to do this show was because this is an international podcast. It's all over the world. And I really feel bad about the fact that I don't care how good doctors are, but it seems like Rudy Giuliani has not had it fixed. I could fix that. I mean, I could fix that in a short period of time. I have a state-of-the-art, Medicare approved, AAA approved, with all professionals. We have an anesthesiologist, board certified anesthesiologist in my place. We do these things all the time. Most of the doctors in the area that diagnose this, they send the patients to me.
Right.
I have 25 years of experience doing this.
Yeah.
When they first came out with it, vertebroplasty, then we started doing the kyphoplasty. There's not too many people that have as much experience as I do, maybe 1 or 2, but not within the immediate area.
Sure.
And I'm sure in New York, where he is, they have him over there. But it's I just don't understand why he hasn't been fixed.
Right.
And if nobody wants to fix him, and if anybody knows Rudy Giuliani, tell him to call me.
Right.
732-262-0700. I could fix his back, and 98% chance he will get off the table and be pain-free. I had a guy one time, a friend of mine who was in the race boat business. He built boats and he raced it. He raced a boat in Malta, Greece. He says he came off a wave, it had to be a 20-footer, came off like the whole boat came off of a building and landed flat. And he didn't have his seatbelt tight enough, and he broke 2.5 vertebrae.
Oh my God.
He couldn't even breathe. He couldn't walk. I was like 36 years old. He called me up. He says, "Can you fix this?" I said, "Absolutely." He had his friend fly him from Rhode Island to Bricktown.
Right.
They brought him in on a stretcher. I look at the MRI. I already looked at the MRIs. I've strategically figured out how to fix it.
Right.
He got off the table pain-free. 2 weeks later, he won a race with a boat that goes 150 miles an hour in Rome, in Italy. So, I mean, he
that was amazing. That's amazing.
I told the company, we got to use him to market it. Right? But they're like, no, we don't need anybody to market. I don't know why they do it.
Yeah.
But this is how drastic the pain goes away.
Yeah.
And you got to know what you're doing. You got to know where to put it. I talk to the reps and they say, most of the guys don't really look at the MRI. They look at what level that the radiologist said is fractured. They go in and stick the needle in there, arbitrarily stick the needle wherever it goes, and they put the epoxy. I look where the crack is. That's why I have a good success.
Right.
Because if the crack is down on the bottom right side and you put it in, you're on the top left side, it's not going to help them.
Yeah.
Chances are it's not going to help them. So you got to go right where the crack is. You got to know where the crack is. I know quite a few people that do this procedure. They say, why do you, just put it in? No big deal. No, it isn't. You got to know where to put it.
Right.
In fact, I've fixed compression fractures that people have already had fixed by other doctors. And I look at the MRI and I see that the cement, the epoxy is nowhere near the crack. So I go in there and I put the tip of the catheter where the crack is. I fill it in. They get off the table pain-free.
Right.
So the point is, it's not just fixing it. It's knowing how to fix it.
Yeah, that's what I've always used to say to patients. It's the difference between knowing what to do and how to do it, and that's where you come in.
And that's the years of experience.
Yeah,
they don't teach you that. When you take the course, they teach you how to do it and how to be safe.
Yeah.
But as far as the detailed technical skill that you develop over the years, you only learn that with experience.
Sure.
So that's it. And I've had quite a few people that listen to my podcast, and we actually have a new, relatively new video on Comcast or on TV.
On TV, yeah.
I don't know if it's Comcast, but
Yeah, Comcast, yeah, and Cablevision.
And I talk about compression fractures, and I ask the patients, "How'd you find out about me?" I'm sitting there. Somebody just told me I had compression fractures, severe pain, and I saw in your 30-second commercial how you can get me pain-free. That's why I'm here. Sure enough, we do it the next day. 2 days later, pain-free.
Oh, we got the lovely Vincenza Jasper. She gives you a little heart there. And
hey, Vincenzo, you should be here helping us with the tomatoes.
Yeah, where are you? And then we got Barbara. She says, got pain? Dr. Jasper can fix that.
I can fix that.
Sure you can.
Yeah, so that's the main reason we're here today, is for the compression fracture.
Yeah, we heard about Giuliani's problem, and you know, it's that you go to Dr. Jasper for that kind of stuff. You know, you don't mess around. You want to, especially locally here. If anything happens to you and you think, oh no, I got to go to New York, have one of these highfalutin New York doctors. No, the best thing is right here at Brick. You got Dr. Gabriele Jasper, and I've been to a lot of other so-called pain management doctors and all of that. The only guy that ever helped me, and I trusted him the entire process, and that's important, is Dr. Jasper.
You brought up a good point, and I bring this up all the time. It's almost like a stigma. Patients look at me after I fix them up and they say, you should be on Park Avenue. You shouldn't be in Bricktown. And I've talked about this on the show. I love this area. Yeah. I love the Jersey Shore. I got a nice house on the water, and I got my boat. I got the Labrador Retriever, dives in the water all day long, swims around. The kids were swimming when they were little. I go in there, I swim. We crab. We got like 25 crabs the other day. We made crabs oreganata. We made crabs with sauce. We made spaghetti with crab sauce. We go out clamming. I mean, this is what I love.
Yeah.
Who wants to live in Manhattan or anywhere near Manhattan?
Nobody eats better than you.
Yeah, and by the way, Manhattan, you probably got quite a few senior citizens there, but I've met so many senior citizens in the Jersey Shore that have moved here from New York.
Yeah.
Moved here from North Jersey, moved here from all over the place, Pennsylvania. They move here. This is the land of the senior citizens. Now, any kind of disease, any kind of broken this, broken that, arthritis of the hip, arthritis of the ankle, shoulders, knees, who does the best job? And I can vouch for them. The orthopedic surgeons around here, they might do 10, 20 of them a week. You go to hospital special surgery, I asked the doctor, I went over one time, I asked the doctor, how many hips have you done this week? He says, you're the first one, something like that. I was like, I'm the first one. My friend's already done 15 of them this week.
Right.
But
well, this is the mecca for seniors. Everybody living in these retirement villages, and they're all hurting, and they're all like persnickety about whether or not they should go see someone like you. The one thing about pain, and I know this from my own past, is that you get complacent with it. It's like the difference, the devil right?
Yeah.
And you're terrified of the devil you don't. And but the thing is that these minimally invasive procedures that Dr. Jasper's pioneered, developed, they're there specifically. Yeah, teach. They're there specifically for your type of condition. You're not going to feel the pain that you think you're going to feel. You're going to feel a lot of relief. Yeah.
Yeah. So I'm sure some people have noticed the shirt that I have on today.
Yes, Sanford and
Son Salvage. Why am I wearing that today? Because I got an ongoing joke in my office that when a patient comes walking through to the front desk, even the front desk people said, I tell them, I said, if they're walking like Sanford and Son, like Fred Sanford, if they walk like that, they got a bad hip. And sure enough, they said, Dr. Jasper, this guy came in for hip pain. He's got a bad hip. He walks just like Fred Sanford.
Well, you had a hip replacement, and you were walking like that for so long. Yeah, I think you even had like the theme song coming out of your pocket when you were coming into a patient's thing.
Yeah. And they fell off the chair. They said, I see people come in here, 10, 15 people a day coming in, and we say, hey, doesn't he look like Fred Sanford? And here you are walking down the hallway like Fred Sanford with the theme song coming out of your pocket. Yeah, that's a funny story. Anyway.
Oh, we got Vincenzo. She said, I'm having my pipes redone here. The floors are open. Bathroom and garage is a mess. But when it's all done, I hope you'll come visit me.
I'm coming. We're going to come.
She misses you.
We're going to come this winter.
And for those of you who are, listening about Vincenzo Jasper, she goes by another name. Was it Moon Jasper Gem? She's an incredible psychic. Look for her on social media. Just type in Moon Jasper Gem, and you'll find her. And ask her for a reading. She's brilliant, and I trust her.
Hey, there goes Lisa Gonzalez.
Yeah, she says you're the best. Now she says, "Hi guys, miss you. We miss you too, Lisa.
When you coming back?"
I know, the most infectious smile you've ever seen in your life. You like when she smiles, something in your head just goes like pinball machine going up.
Smile.
Yeah, beautiful smile.
Anyway, so that's it. Probably like I said, Rudy Giuliani wants to get fixed. I can fix that.
You can.
And guess what? You hear Jasper Giuliani. My real name was Di Gasparo, but they changed it when they came over. So one paisan to the other.
Right.
I'll fix you. Ti aggiusto io, non ti preoccupare.
Oh, look at this.
Anyway.
And that's not the only thing you do. I mean, you do. Yeah. I mean, if Rudy Giuliani needs your help and needs it fast, yeah, please call him.
We can have it done. But we could do it Tuesday.
Do it Tuesday. Yeah, and you're back to work.
Bring the MRI. Send me the MRI, and we'll go over it. And we'll set you up.
But
anyway, so yeah, it's not the only thing I do.
Yeah,
there's tons of things that I do along those lines where it has advanced. Even from the first time I did vertebroplasties, kyphoplasties, the delivery systems have improved tremendously, much safer today.
Yeah.
And I think because of that, more doctors are starting to learn how to do it.
Yeah.
Which is good because, I can't fix everybody. I'll try.
Yeah, you do a damn good try. I'll tell you that.
And another thing I'd like to talk about, if there's anybody out there that's looking for a job, looking to work at an interventional pain center, a busy interventional pain center that does all the newest evolved interventional pain procedures, this is the place to come. Sometimes doctors are reluctant to come here because they're not going to get any referrals from spine surgeons. Very few referrals from spine surgeons. I was just saying, I hope the air conditioner goes on soon.
Oh, yeah.
Yeah, and and why? Why do I not get referrals from spine physicians? Because if they send them to me, chances are they're not going to see them again because of all of these new things that are out there today. And this is very important on this talk. The new things out there today have virtually eliminated my having to send patients for spine surgery. And believe me, I used to send a lot of patients for spine surgery, and that was years ago. It's probably been about 8-9 years since I've sent anybody for lumbar spine surgery because of the fact that every 6 months something new comes along, and I fix it without the spine surgery. I know the surgeons might not want to hear that, but maybe they should listen. They should listen and come and learn how to do these things. I'll teach them. Like I said, I can't do everybody. And if everybody did what was right for the patients, it would be better for the patients and better for the doctors.
Yeah.
You do unnecessary spine surgery. I'm not saying everybody does it,
right.
Because when you need spine surgery, you need it.
Mm-hmm.
And I'll be the first one to tell you. The cervical spines are a little bit more advanced as far as open traditional spine surgery, because I see great results with that. Because I think, nobody will get something done in the neck because they're very nervous about operating on the neck unless it's really bad and the epidurals don't work.
Right.
And it's not as advanced in the neck as far as minimally invasively because because it's a small area and most of the surgeries in the neck are minimally invasive today anyway.
Right.
Some of them get carried away and do like a 5 or 6 level fusion, which might be a little overkill. I don't think anybody really needs 5 to 6 unless they have a major car accident and broke their neck or something.
Right.
But anyway, let the surgeons decide who need spine surgery for their patients.
Yeah. Now I called the office yesterday and put myself on the schedule for my arthritis.
Oh, radio frequency ablation.
Yeah.
How long's it been?
It's been a while. It's been maybe 2 years. Definitely. In fact. And now I just feel like somebody's giving me haymakers in my midriff, and I feel like I've just come out of a fight, and I'm like, look at this. I got it right here. I can show you on the camera. Ibuprofen just to take the edge off. It's bad. It's bad.
Ibuprofen. Anybody tells me the only thing that gets rid of the pain is ibuprofen, Aleve, stuff like that. It's usually arthritis. Because if you had nerve pain, like like a sciatica pain,
yeah,
it won't get rid of it. It'll get rid of some, because a lot of people have arthritis pain with the nerve pain, and it'll get rid of the arthritis pain so they feel a little bit better.
Right.
But the only way to get rid of the pain from the pinched nerve, which is a swollen nerve, is decrease the inflammation. And sometimes you decrease the inflammation, and it still won't go away because there's just not enough room in that tunnel for it to live. And what happens at that point? I make the tunnel bigger, and I got many ways of doing that. I could do it endoscopic, which, by the way, we did a patient last week. It was Thursday. Endoscopic surgery. He didn't have good insurance. The guy paid cash. I have this mental problem about taking cash from Medicare patients. The guy was, I think, 75, 76 years old.
Right.
And he had pain shooting down his leg. It was his right leg for years.
That's the worst.
He didn't want major spine surgery.
Yeah.
He says, I'll live with it, because lucky for him, he had friends of his that had that spine surgery and they did poorly. A couple of people, he says, I'm not going through that because they're worse now than they were before the surgery.
Yeah.
He has pain down his leg. It was severe. It gets severe and it gets a little better, it gets severe. But his life revolves around that pain down his leg. He can't do anything. And the guy's athletic, So I looked at it and I said, you need endoscopic surgery. And endoscopic surgery is where, I don't have a scope here, but where I'll go in to the spine, I'll look at this herniation, right? And I'll come in and I see it and I pull it out.
Yeah.
But he had more, the herniation was there for years. And he had a little shifting of the spine, where they got a spondylolisthesis, which means this anterior listhesis would mean this was shifted forward. This is shifted forward, which it stretches and it makes all the ligaments, the neuroforamen, hypertrophied, and they get thick, and there's no room for the nerve. That nerve coming out gets pinched like crazy, and that's the pain down his leg. And we isolated to that level, which was his L3-4. I went in there, and it was there for a long time. So it wasn't like going in and pulling out a herniation, and it comes out one clump. And sometimes I'll do an operation like that in 10 minutes. Pull it out, nerve drops, everything's free. Patient's on the table awake. Says, my pain is gone.
Right.
Well, it took about 55 minutes to do the whole thing, skin to skin, which is still pretty quick. No blood loss.
Yeah, that's
no
fast.
Creating scar tissue. I went in with the scope, and I'm looking at a monitor, bigger than the monitors we're looking at right now. And I see that herniation. It's right here. I see the herniation with the scope. Here it is, right here.
Yeah.
I see the herniation with the scope. Here's the herniation right over there.
Yeah.
And I go in with instruments like that, and I grab the herniation and I pull it out and I clean all the bone spurs off. When I got significant amount out, I asked the guy on the table, I said, you came in here with pain down your leg. He goes, Doc, I've had pain in my leg forever. I said, what about now? He goes, I got no pain. And you think, well, it might be the anesthesia guy, gets a little fentanyl, a little painkillers, he gets anti-anxiety, amnestic drugs like fentanyl. So you got to take it with a grain of salt. We brought him to the recovery room. I went out there 45 minutes later, wide awake, standing up. I said, do you have pain down your leg? He goes, no. And he's walking around. His wife said, I can't believe he doesn't have pain down his leg. I said, let me ask you a question. When was the last time you did not have pain down your leg? He goes, 10 years ago. This guy went 10 years and he spent money.
Oh
I'm
my
not going to
God.
disclose how much money now that he spent. It wasn't stupid money,
Right.
but it was for somebody on a fixed budget. It's significant.
Sure.
Like I said, it hurts me to ask him, but I got to pay my overhead. And it's spine surgery. You know what he said to me? I didn't even talk about price. He said, Doc, he goes, that was the best money I've spent in years, and it was worth every penny of it.
Right.
You know, so when you can get results like that, and that's what I do.
Yeah.
That's really what I'm famous for. You know, I teach that procedure all over. It's kind of, it hasn't been, it's not obsolete, but you know what? With the new spacers and
Well, you pioneered
yeah,
procedure, you know.
even if somebody starts it now, it's still a pioneer.
Yeah, even the spacers. I don't think there's anybody in this country who's done as many as you have.
No, there's nobody in the world that's done as much as I have. You know?
Right.
But why? Because where I live.
Yeah.
Not knowing how to you have to know how to make a diagnosis.
Right.
And you got to know how to do it and not feel intimidated and be an interventional pain physician. You know, most pain physicians just treat patients with a couple epidurals, pain medication, spinal cord stimulators, and they send them to surgery, you know. And well, first not in that order. They send them to surgery, and then the surgery failed, then they put the spinal cord stimulators in.
Right.
But that doesn't happen in my office. I'll put spinal cord stimulators in. Most of the patients that come to me that have had spine surgery or they have like a reflex or sympathetic mediated pain, that you just can't get rid of their pain no matter what. Then you put a spinal cord stimulator in, which is, you know, you put wires, electrodes up into the epidural space, and you find a sweet spot and you turn it on. And in a lot of patients, it'll turn off the pain.
Yeah.
You got a pain generator, it'll stop it in the spinal cord, trick the spinal cord to the point where you don't even feel it in the brain.
Right.
So if you have pain, who cares if you don't feel it? Right. So, I mean, that works tremendously, but there's too many of those going in for unnecessary reasons, for reasons that shouldn't go in, for reasons that I could fix.
Right.
You know, I've had people come to my office with spinal cord stimulators with spinal stenosis, and I treat their spinal stenosis with maybe a mild procedure or spacers, and the pain goes away. Next thing they ask me if I could take the spinal cord stimulator out. I don't always take it out. It's bothering you. No, all right, let's not open up a can of worms.
Right. If it ain't broke, don't fix it.
Turn it on.
Yeah.
I had a guy that I did a trial, because you get a spinal cord stimulator, you do a trial. You got to go to a psychiatrist to make sure that mentally and you can handle it. In other words, I don't know what their criteria is, but you got to be able to understand that this is not a cure, right? You got to be awake and alert and oriented times 3. You got to be smart enough to understand the process. You understand that you might turn the severe pain into a warm tingling sensation. Somebody might not want to accept that. This is what the psychiatrist tries to figure out. And they say, all right, the patient is a candidate for it. Then you do the trial. And if they don't love it, I tell them I'm not going to put it in. See, what the problem is with spinal cord stimulators, and I've learned this by talking to spinal cord stimulator reps. I asked a few of them, why do these trials work? And then you put it in, it doesn't work. He said, this one particular one said, well, the reason why is, first of all, you got the reps. You put it in, they meet the reps before you put it in. They become close to them. They explain everything. Now you're getting mental, psychological support. And then they can go into the recovery room and they work hard, these reps, and they'll try to get that working the best it possibly could and get the right program to try to get rid of as much pain as they can, because that's their job.
Right.
And they tell them, listen, if you feel the pain, it's not enough. You call me up tomorrow and I'll come adjust it again. They do that for 5 or 6 days, up to a week.
Oh, God bless you. God bless you, Doc.
And so now they got this attention. Somebody at their beck and call for a week or close to a week. And then all of a sudden, it goes away. They say, yeah, all right. And then I put the permanent in. And after about a month or so, nobody's calling them, only if they need to. They're not over the house all the time. They're not every hour on the hour calling, whatever. They don't have the attention anymore. all of a sudden it doesn't work. And I think it's psychological.
Right.
You know, so I tell him right off the bat. I told this guy, I said, listen, I said, don't get a full sense of security because they're all going away after that completely. You know, you might need occasional programs. They're there for you, but not like during the trial. So don't get too used to that.
Yeah.
And the guy didn't do great, but then toward the end, last couple of days, he was doing good. He definitely had improvement. So he's interested, but he says, you know what, I'm going to take the, because I don't encourage these people.
Right.
You can't encourage them because there's big money involved with the insurance company. And it's big money involved that I can make good money doing this, but you know, I got to sleep at night. I got to look at myself in the mirror.
You got to,
and I believe in karma.
Yeah, yeah.
Right. So I don't encourage it. I don't discourage it.
Right.
But I tell him, he said, you know what I'm going to do, Doc? He goes, I feel pretty good with it in. Take it out because I had to take it out. He goes, let me wait about a month.
Yeah.
He said, if it comes back the way it was, then I want you to put it in because now I know how I feel with it and I can compare. See, now that's a rational decision.
Right. Right.
And when he gets it in, if he just decides to get it in, I guarantee you that it'll be a permanent one. He's not going to ask me 6 months down the road, please take it out. It's not working.
Right.
You know, that's not guaranteed, but this is the way I do my job.
Yeah.
You know, it's the way you got to do it.
Doc's the most stand-up guy you're ever going to meet.
Well, thank you.
Yeah, you are, dude. You're the most stand-up guy I've ever met in my life. And that's important, especially when you're looking for a doctor you can trust. And if you're dealing with severe pain, you need somebody who's going to be with you for the long haul, you know, like following the process until you can, you know, regain your lifestyle.
That's a good, you always bringing these good points up. Somebody's going to stand by you.
Yeah.
You know, when somebody has a bad back, they got a bad back forever.
Yeah.
Somebody's got a bad knee, they got a bad knee forever until they replace the knee. Same thing with a shoulder, same thing with a hip. That you pretty much get rid of if you get a good orthopedic surgeon. But the back is a progressive disease, and it's all derived from degenerative disc disease. The disc breaks down and everything else comes. The arthritis comes every level with age. That hurts, especially in the morning when you get up or sit down for a long period of time.
That's what I'm going through now.
So you're going to have pinched nerves. Why is it pinched? Because maybe you got a herniated disc and you have degenerative disc disease that causes a herniated disc, and you got decrease in the size of the tunnel where the nerve goes.
Right. I
could open it up, but it's a progressive disease. So something's going to pop up in the future. You know, you could have, spinal stenosis. You fix one level of spinal stenosis, the other one's coming.
Yeah.
Yeah. You know, especially if it's genetic in your family. I was telling a patient the other day, he goes, Doc, can you fix this once and for all? I said, I'm going to fix this, but is it going to be fixed forever? You need to understand that you need somebody like me. If you move out of this town or you go somewhere else, you need somebody that's going to maintain you. I had a young guy come in with 3, 4, and 4, 5 moderate to severe degenerative disc disease from a trauma that he had when 15 years ago. The guy was like 36 years old. You know, when he was a teenager, he had this trauma, and the other discs look good. But those 2 discs are going to bother him for the rest of their life. And there's no surgery that they're going to fix that once and for all. You know, if they had a surgery, you sneak something in there, which they do, you know, sneak something in there, it might help it. But just by the surgery in itself usually causes other problems. And you're going to have chronic back pain down the legs. The idea is to find somebody that knows how to get rid of it without destroying your life.
Yeah.
Maintenance therapy, maintenance diagnoses, and fixing some problems that come out. You got a young person gets a herniated disc, severe pain down the leg. You take that herniation out, the pain is gone, maybe forever.
Yeah.
Well, why did that happen? Maybe a trauma. But once you traumatize that disc, and you squirt out a herniation like that, you've destroyed the nucleus. This nucleus now is already half out here, right?
Yeah.
And then on the inside, this starts to get degenerative, and it's just, you're on your way.
Yeah.
Ain't nothing happened. there are, and I talk about this all the time, and you're talking 15 years ago at one of the conferences in France that I presented at, a guy presented that they found out the genotype, a person that in the family that has a gene that will make the disc degenerative faster than most other people because they're lacking an enzyme. And all I got to do is replace that enzyme and it'll maintain the disc. I said, the future is great for these patients.
Yeah.
Maybe not too great for us because if they stop that process, then we'll be out of a job.
Yeah, they ain't coming back
you know
after
what?
that.
When I said that and I saw that nothing happens, 15 years, nobody's figured something out. You know what that tells me? Somebody's paying off somebody.
Yeah. Yeah.
Because they don't want to lose their job. The hospitals, the lobbyists, politicians, the insurance companies. Who the hell knows? The people inventing this stuff. Hey, listen, take $10 million and just shut up.
Right. Right.
This isn't my theory. But why? If they found that somebody's lacking an enzyme,
yeah,
why can't they?
Because there's innovations coming out for everything else. So for the ones that hey, this could significantly change this patient's lifestyle. Yeah, you're right.
Well, there is one procedure now that came out a few years back that I do. It's called via disc, and we talked about that a lot.
Yeah,
where I replace the nucleus. This nucleus in the middle, I replace it. And the insurance companies claim, I'm not the insurance company, the company that produces this, it's an allograft. It's an actual nucleus taken from a cadaver that has a perfect nucleus. People donate their body to science. Perfect nucleus. And they've compared the perfect nucleus with the allograft that they retrieve. They compare it, and it's exactly the same or close to it. And you put that in there, and the patient's pain goes away that has discogenic pain. You're basically, like you need a kidney transplant, you put a new kidney in, now they got a new kidney. You need a transplant for your nucleus. It's an allograft. You got a nucleus transplant. They're claiming that it stops dead in its tracks the degenerative disc disease process. But the problem is that the insurance companies don't pay for old people. They're senior citizens over 65.
Yeah.
And of course the Medicare disadvantage, they don't pay for shit anyway. They won't pay for that. But the mere fact that Medicare pays for it because it's been proven that it works and it helps these people, which ultimately, if you think about it, if it prevents degenerative disc disease, Medicare is going to save money in the long run by treating all the complications of degenerative disc disease.
Yeah.
And you get somebody, I got patients 40 years old that need that. But the traditional commercial insurance won't pay for it yet. Who knows if they will? It's expensive. Maybe you work a deal out with the company to come down a little bit with the prices. It's expensive, but ultimately it might be worth the money.
So we got Ron here. He says, best spine specialist around for me and my family. Dr. Jasper is number one.
Hey, Ron, how you doing? I got a friend of mine and patient who's got some kind of lesion in his well, wait a minute. Yeah, he's got these major sinus problems. He's had stuff done, but he's up way in Elmira, near the Finger Lakes, and I don't know if they got any good ENT docs. I'm gonna hook him up with you. I'm gonna give him your number. His name is Roscoe. I'm gonna give you his number, and he comes down to see me for some treatment. He drives 5.5, 6 hours, and he wants to take us fishing in Lake Ontario. He's got a boat. That's what he is. He's a fishing guide, and he owns vineyards. So we get a little wine and a fishing trip out of the deal.
Hey,
I know you like that kind of stuff.
Very nice.
I'm going to send them to you. But thanks for the comment, Ron.
Yeah, I was going to say the new patients I speak with, the ones that are terrified about, hurting more. There was this one patient I spoke with, and she was like really, really scared about, the pain, the pain you don't know. And I was telling her the importance of sticking with the process that you create for them. See, so many, we not so many, but we get every once in a while we'll get a patient who, he's fed up. He wants a one and done process, and he starts going off to somebody else. And then, of course, what does he do? He comes back to you
after he screws himself up.
After the other guy screwed him up a bit, and then you're like, well, why did you do that? We had you all set up here.
Patience. That's the first thing I do. I talk more about patience today to my patients.
Yeah.
That they need to have patience than they ever did.
Right.
Because a lot of them don't have patience.
Yeah.
And you got to have patients that are smart enough to understand why they got to have patience.
Right.
I spend a lot of time with them. You get a patient that has a 5-level disc problem.
Yeah.
Maybe 4-level spinal stenosis. I treat one level at a time, and sometimes it's more than one procedure at that level.
Yeah.
So you're talking, by the time I'm finished with that guy or that woman, it could be over a year.
Right.
Over a year, maybe 2 years. They usually slowly get better, but they might not until I'm done fixing them.
Yeah.
That's the patient. I give patients credit when I work on them and they say, Doc, listen, I trust you. Because I tell them, what's the alternative? You go to a surgeon and you have him fix you once and for all.
Right.
But that might not be good for you. That might destroy your life.
Yeah, I saw a patient this week that she was, she comes, oh no, I'm not a new patient. I've been with Dr. Jasper for quite some time, and I absolutely love him. I'm like, so what are you doing now? You coming in for a tune-up? Because that's what I need. Every once in a while, hey, I haven't had a problem in 2 years. Okay, that's a massive result. And now, my arthritis is starting to act up, and I need a tune-up. And thank God we have somebody like Dr. Jasper, because if we didn't, I don't know. I don't trust any other guy.
Well, see,
that's my thing. I don't trust anybody but you.
That's one of the reasons why I always say on this podcast that I got to find somebody who's smart, willing to work hard, take care of their patients, see every one of their patients.
Right, right.
Like old school doctor. That's what it is. And that's the way you get success. Somebody that's going to, hey, listen, I ain't no spring rooster anymore. And I don't have any intentions on retiring anytime soon, but I like to cut back a little bit, maybe take some trips, do stuff.
Yeah.
Not that I don't do it now, but I want to take 2 weeks off and go somewhere.
Sure.
I take 2 weeks off now. I got 25 employees. What are they going to do?
Right.
Sit around? They can't sit around. Then I come back. We won't have any patients to take care. I got no money to pay them. So we need to, and by the way, I like to have somebody that I could train so that one day in the future, if I do retire, there's somebody who's going to hold the fort and take care of the patients.
Yeah.
Like this week I had maybe 4 or 5 patients that are relatively new within the last 6 months, and
right.
They're relatively young, maybe in their 50s, 40s, 50s. When they're 75 years old, I don't think I'm going to be treating them.
Right.
They're like, Doc, what do I do when you retire? I said, hopefully we'll have somebody that's willing to work hard. And when I say work hard, I mean, I work hard, but I enjoy my job.
Oh, yeah. Yeah.
I enjoy it because you come into work and it's all positive reinforcement all day. Unless you get an asshole,
right?
You can't help them,
Yeah. I mean, maybe, during the day when you're seeing patients, you get a minute or two, in between, just to grab some days he's just grabbing whatever's on the kitchen table and throwing it in his mouth, and then boom, he's back out again.
No, I mean, I'll sit down and I'll use something lately. Hey, listen, I'm Italian. You gotta have lunch.
You gotta have lunch.
I might have a 15-minute lunch.
Yeah.
But
you're pumping out. You're spending so much time with your patients, sitting down, making sure that they know what's going to happen to them.
I need to. The problem is that I put an ad. I think I got headhunters out there, the people looking.
Mm-hmm.
We got ads looking. I want somebody I want an anesthesiologist, interventional pain doc, that's willing to do a little bit of anesthesia in the beginning, right? Because you never know when you can't get an anesthesiologist.
Yeah.
I'm not going to commit to, listen, you just come in and just do pain management and no anesthesia. I don't want to do that. It's a special practice. You have to be multidisciplinary practice. I mean, even the nurses do things that I got technicians here, like Nicole, she's an x-ray tech. She does everything.
She does everything.
She does everything. And this is the way the practice is set up.
Yeah.
Because if you had to have individuals that do all of this stuff, you couldn't afford it.
Right.
And you don't need it, because if you had individuals to be sitting around doing nothing for a long time, just waiting for their particular job. This is not a hospital where people, you can have, they got so much business going on all over the hospital that one particular specialty technician will go all over and work all day. No, you've got to be multitask. And that's what I'm looking for. Yeah. So these people are like, I don't want to do any anesthesia anymore. So it's hard to find somebody. And these people, you know what they want to do?
What?
They want to just work in the hospital or work for a big conglomerate and go to work from 9 to 5.
Yeah.
Go home and not have to worry about anything. And they probably get a good salary. That's not why I went into medicine. That's not why anybody in the old days went into medicine. You went into medicine because you want to be independent from this big conglomerate. You want to be independent from the hospitals. You want to make your own decisions, which is harder every day now because of the insurance companies.
Right.
And that's probably one of the reasons why they're falling back, going into these big conglomerates. But they don't want to do what I do. I mean, it's ridiculous.
Yeah.
Hopefully somebody will come up. We got time.
Yeah.
We'll find somebody. Somebody's smart and willing to work.
Yeah.
And by the way, the practice is always going to be here. This is the kind of practice patients like.
Yeah.
They sit there and they talk to the doctor.
Yeah.
The doctor explains it. I have my nurses, I have my technicians, I have everybody that sits down and they talk to the patient. They explain it, then I explain it, then they explain it again.
Yeah. Some of the patients I sit down with and I talk to, and I'm explaining things thinking that they don't understand.
Yeah.
Right. And then they stop me in my place and they're like, no. She says, I know this. Dr. Jasper explained all this, and they're talking it back to me like, they're a doctor. They know their condition so well, and that's huge. A lot of people like to go into a place. I don't want to think about it. Just do what you got to do, and I'll leave.
You're the doc. You make the decision.
Yeah.
They got to sign and consent. They got to understand.
Yeah.
Yeah. So real quick, what do? I do your generic epidurals, not generic. I do specific type of epidurals that actually work.
Yeah.
I don't do, very rarely I do a caudal. Sometimes I do a caudal with lysed adhesion somebody has. If the transforaminals don't work. People always ask me, how come you want to do the same injection that the other doctor did? And the next question they ask me is, why did yours work and theirs didn't?
Right.
Because you got to know where to put it.
Yeah.
And you got to be able to put it. You can know where to put it, but maybe not be able to put it where you know where you got to put it.
Right.
But everybody in my surgery center knows where it's supposed to be. Technicians, the nurses, and you come to my surgery center. Hate to intimidate you. Come to my surgery center. You put the needle where it's not supposed to be. Everybody's going to know except you.
Yeah. Yeah.
So and if you have a problem, I can teach you.
You're not like, stab somewhere with a marker. So, okay, the needle's going to go in this one. Yeah, to me, when I was a patient and I saw a doctor do that to me, I was like, oh boy, there's a lot of room there to be mistaken.
I had a patient yesterday that said, I'm 80% pain free. And it was hard for me to believe because he had such bad stenosis.
Yeah.
And it's been almost a month. And he says, I've had at least 10 injections, same epidurals that you gave me, and they would last for 2 days.
Yeah.
It's already been almost a month. He said, but I could tell that feeling that I had when you put the medicine and I could feel it like going along my nerve,
right
down my leg. I never experienced that. I was like, what the hell is that? But now I know what it is.
Yeah.
I mean, you must have got it right in the right spot because I'm 80% better. And I don't need anything else. And this guy has another 2-3 bad levels, spinal stenosis, and he feels so great because it's, probably not as great as we would want to feel, but
sure,
he feels so great compared to the way he's been in the last 5 or 6 years. He's like, I'm good.
Yeah, yeah.
Because you put it in the right spot.
People who suffer pain can deal with so much pain. I could. And so, yeah, you take away a couple of these generators, these pain generators, and yeah, you'd be all right for,
But you
this
gotta
is
know
great.
which ones to get rid of first.
You have to know which ones to get rid of first.
If you try to get rid of the arthritis before the spinal stenosis, it don't work.
Right.
I had a patient. Another thing that I see all the time is I'll ask the patient who has severe spinal stenosis or moderate spinal stenosis, and I say, first thing I'll do is, how far can you walk? Oh, I walk 5 miles. I say, okay, let me rephrase that. How far do you walk before you experience pain in your low back and into the buttocks? Well, I don't know, doc. Let me see. I walk 5 miles a day, maybe 2 miles. I said, well, 2 miles. I said, if I can walk 2 miles with no pain, first of all, I won't walk 2 miles. I call an Uber before I walk 2 miles. But if I have to walk 2 miles, if I walk 2 miles with no pain,
Yeah.
I wouldn't be going to the doctor's office because I wouldn't even know if I had pain because I never walk 2 miles.
Right.
I walk around all day in the office and all that stuff, but who the hell gets up and walks 2 miles? I got better things to do.
Right. Right.
I'd rather get in a car and race on the track for all day long on my motorcycle or something. But anyway, then I say, listen, I got a homework assignment for you. You think you can walk 2 miles? I'm looking at your spine. I said, I bet you can't without experiencing pain. He goes, well, no, I said, but the problem with you is you've had it for so long, you don't realize you have pain. You just keep walking. Right? I said, your homework, while you're getting a new MRI, your homework is you do your walking, and I want you to count your steps or the blocks when you start to experience pain.
Yeah.
Almost everybody comes back and says, doc, you know what? I walk 100 feet and I start to feel pain. I mean, the MRI doesn't lie. You can't treat somebody based on what you see in the MRI all the time, because sometimes you get patients that I call phenomenal. They don't have any pain and they look like they shouldn't even be able to walk. That's the way it is.
Yeah.
So what else? We do, there's so many different things that I do. Look, you got back pain, you got neck pain, you got pain down your arms, you got pain down at your legs, you got hip pain, knee pain, ankle pain, vesicachibata pain. I'll get rid of it. I'll get rid of it, or at least I'll try to, and I'm pretty successful at doing it.
Yeah, yeah.
I've been doing it for years, and sometimes I amaze myself how I can get rid of the pain.
Yeah.
What are you doing?
I'm just giving you the minutes. We got 2 minutes left.
2 minutes left?
Yeah.
What, are they going to cut us off?
Yeah, they will. Oh, yeah.
Well, because you got your show now.
I got a show now. Yeah.
Now that with no messing around. All right, everybody. I got to go buy another big pot so we can speed up the process. Take maybe 3 hours off of the tomato day.
Yeah.
Because we got like 35 bushels of tomatoes. We got about 20 people or more helping us, hanging out. We got the music going, drinking some wine.
I'll be there after my show.
And at the end of the day, we make what we call as a spaghettata. we take the last part of the sauce. I fry a lot of olive oil and garlic. We got plenty of basil. We fill it up with basil, and we make pasta, and we have a good time.
That's great.
That's at the end of the day.
Yeah.
And I better get going. Thank you very much. It's great talking to you. Rudy Giuliani. Give me a call.
Yeah.
I can fix your back. And you'll appreciate it. Believe me. There's no reason for you to be walking around in a brace. Take that brace off. I fix your back. You don't need the brace anymore. You got nothing broken.
Right.
It's fixed. It's fixed. You don't need it. Just don't have another car accident.
Yeah.
You know,
Yeah. Be
you don't
careful.
need the brace. You need to have it fixed. All right.
All right. Take care, everybody. For more information about Dr. Gabriele Jasper and all the things we talk about, please go to jaspermd.com to make an appointment. Call 732-262